It's always great to see so many faces from years gone by, and so great that we have such great speakers and patient involvement again this year. As Jason indicated, I'm founder and chair of Melanoma Network of Canada. I didn't just stumble upon it, I'm also a patient. I've had melanoma 3 times over the years, but I'm heading up another 5 years free, so I count myself lucky for that. Thank you. Let me start by saying that patients are in a much better place today than they were even 5 years ago. We got into this world, almost 10 years ago now with the organization. But at the time when we started, there really wasn't much to be optimistic about in the treatment of melanoma. And I think that landscape has changed significantly since 2012. We've seen considerable advances in not only the way we treat melanoma, but I think in the level of understanding in the medical community and also in the patient community about melanoma itself. Yet with the growing prevalence of melanoma diagnosis amongst Canadians and ongoing pressures in healthcare budget, equal access to the latest scientific advancements and the affordability of the new drug therapies that are coming out are becoming an increasing challenge for us right across the country. Improving the efficiency of cancer care in the country is a must, and we must start with a clear understanding of what outcomes we're trying to achieve. For the metastatic patient, I can probably say it's improved quality of life and better chances for longer-term survival. At MNC, we believe cancer affects the whole person, both physically and mentally. For many of us, we know what that day was when we were diagnosed and what it meant and how it does have a lasting impact, and it does change you. And it has an impact not only on yourself, but on your family members. So there's a lot of us that are affected. And I think if you had a show of hands out in the community, there's very few people that haven't been touched in some way by cancer or a cancer diagnosis. So our mission is to support individuals whose lives have been changed by melanoma. And we're advancing the prevention of melanoma through education and advocacy. And I guess I better change slides here as I go through. This is from our walk last year. So for the past 8 years, we've been delivering sessions like this right across the country, and you'll see we've got quite a number scheduled for this year, so right from Nova Scotia all on out to Alberta. And we've been delivering not only sessions like this, but incredibly valuable, I think, patient resources, both online and hard copy. We support publications, information sessions such as this. In 2016, we received over 2,000 patient support calls and emails from people across the country. And we also participated in a national walk, which happens every year in September. For those of you, there's one in Sunnybrook Park coming up in September. We hope to see you out. It helps us to not only raise funds for awareness of the disease, but also to educate the population and prevention efforts. One of the things that we're most proud of is our efforts in Ontario to provide information and education to the Ontario Camp Association, their member camps. We've developed a camp information program and training for the camp counselors to hopefully prevent disease in the youth population. And we've distributed over 50,000 free publications on prevention in this past year and early detection of melanoma nationwide. Patient and mental health support is at the forefront of everything we do, along with creating a national network of medical experts. We're dedicated to advocating for timely access to treatment across all provinces and territories and uniting the patient voice. The information gap is one of the biggest challenges melanoma patients have once they're diagnosed. Not having enough information about the illness, treatment options, benefit and risks of treatments, accessing clinical trials, and how to find emotional support in this journey are real issues, and our patient community faces them on an ongoing basis. Tonight we hope to close some of those gaps and provide you with valuable information to take forward with you and on your patient journey.